"We're losing him," a military doctor screamed, hands pumping chest compressions without stopping. 25 experienced combat medics surrounded the field operating table, sweat pouring, blood staining the surgical drapes. The heart monitor flatlined with a cold, merciless tone. No one spoke, but their desperate eyes already knew. There's nothing more we can do. In the corner of the room, a young nurse clenched her gloves, heart pounding. She took a deep breath, eyes fixed on a tiny detail no one else noticed. "Wait, that's not the heart. Look here." The entire operating room held its breath. Anna Keller stepped into the NATO medical facility in Poland like she was entering a world that didn't want her there. 24 years old, a Swiss nursing intern who had arrived at the base just 3 weeks earlier. Her small frame seemed fragile in the military environment. Blonde hair braided back, wearing scrubs that appeared too big for her petite body. In the combat medical unit, everyone called her the timid rookie. She looked younger than her colleagues, moved quieter than the seasoned military medics, spoke softer than the battle-hardened doctors who ran the field hospital. "She only knows how to change bandages and hand out pills," Dr. Weber laughed during a break between surgeries. "Don't expect much more than basic nursing tasks." Captain Martinez, the head trauma surgeon, was even more dismissive. "These civilian volunteers are well-meaning, but they don't understand military medicine. Keep her away from critical cases." Anna listened to these comments in silence. She never argued back, never defended her qualifications, just quietly took notes after each shift, studying every procedure she had observed. When the senior doctors performed complex surgeries, Anna would position herself in the corner of the operating room, watching every movement with intense focus. Her presence was so unobtrusive that most surgeons forgot she was there. "Don't watch too closely, doctor," Klaus warned her gently during one particularly bloody trauma case. "It might overwhelm someone with your limited experience." Anna nodded respectfully, but her eyes never left the operating table. She absorbed every detail, how the surgeons controlled bleeding, how they prioritized multiple injuries, how they made split-second decisions under pressure. Her small acts of kindness went mostly unnoticed. She would braid hair for female patients who couldn't lift their arms, hold the hands of delirious soldiers during fever dreams, catch water cups before they fell from the trembling hands of wounded warriors. The medical staff assumed she was too timid and inexperienced to contribute meaningfully during high-stress emergency situations. They saw her quiet demeanor as weakness rather than focused observation. But Anna's silence allowed her to see details that others missed. While senior medics focused on major trauma, she noticed subtle changes in breathing patterns, small variations in skin color, minor inconsistencies that could indicate hidden problems. During her off-duty hours, Anna studied advanced trauma medicine in her small quarters. She had brought medical textbooks from Switzerland, journals on battlefield surgery, case studies of complex emergency procedures. "Why are you reading about cardiac surgery?" asked Lieutenant Sarah Chen, another nurse. "We're not qualified for that level of medicine." "I want to understand what I'm seeing," Anna replied simply. "If I'm going to be in that operating room, I should know what's happening." Her methodical approach to learning irritated some of the more experienced staff. While they relied on years of hands-on experience, Anna was building her knowledge through careful study and precise observation. "She thinks she can learn surgery from books," complained one medic. "Real medicine requires instinct, not textbook theory." But Dr. Reginald Harrison, the base's chief medical officer, had begun to notice something different about Anna. During particularly chaotic trauma cases, while other staff members focused on their assigned tasks, she seemed to maintain a broader awareness of the entire situation. "You see things others miss," he observed after one difficult surgery. "That's unusual for someone with limited field experience." Anna smiled quietly. "When you're not actively performing procedures, you can observe the whole picture instead of just your own piece of it." The truth was that Anna had more experience than anyone realized. Before volunteering for military service, she had spent 2 years working in the trauma center at Zurich General Hospital, one of Europe's busiest emergency medical facilities. She had chosen not to emphasize her civilian credentials because she understood military culture valued battlefield experience over hospital training. So she accepted the rookie label and used her position as observer to learn military-specific trauma protocols. Her small room was filled with detailed notes about every case she had witnessed, sketches of surgical procedures, observations about equipment differences between civilian and military medicine, questions about treatment variations she wanted to research. A wounded soldier later testified, "She didn't talk much, but her eyes had this intensity that made me feel like someone was really paying attention, like I wasn't just another casualty on an assembly line." The morning of November 15th started with routine medical rounds and equipment maintenance. Anna was organizing surgical supplies when the base alarm system erupted with urgent medical codes echoing through every corridor. An armored ambulance screamed toward the medical facility, emergency lights cutting through the gray Polish morning. The radio chatter was intense but fragmented. High priority casualty inbound, multiple trauma, VIP status, ETA 2 minutes. But when the ambulance doors opened, the entire medical team froze in shock. General Bauer, 61 years old, one of NATO's most respected military commanders, was unconscious on the stretcher. Blood soaked through field dressings covering his chest and abdomen. His face was pale, breathing shallow and irregular. "Jesus Christ," whispered Captain Martinez. "If we lose the general, the entire European theater is going to fall apart." General Bauer wasn't just another casualty. He was the strategic mind behind NATO's current operations, the leader who held together fragile alliances between 12 different countries. His death would create a command vacuum that could take months to fill. Within minutes, 25 of the base's most experienced combat medics swarmed into Operating Room Alpha. This was the medical equivalent of an all-star team: trauma surgeons with decades of battlefield experience, anesthesiologists who had worked through countless emergencies, surgical nurses who could anticipate every need. Anna positioned herself in her usual corner, watching quietly as the medical team worked with practiced efficiency. The general's vital signs were displayed on multiple monitors, each one telling a story of a body fighting for survival. "Multiple fragment wounds to the chest and abdomen," announced Dr. Weber, examining the injuries. "Probable cardiac contusion, possible internal bleeding. We need to move fast." The surgery began with textbook precision. Senior surgeons worked systematically through each visible wound, removing metal fragments, suturing damaged tissue, administering blood transfusions to replace massive fluid loss. But despite their expertise, General Bauer's condition continued to deteriorate. "Blood pressure dropping," called out the anesthesiologist, heart rate becoming irregular. Captain Martinez increased the pace of chest compressions while Dr. Klaus prepared emergency medications. Everyone in the room understood the stakes. Losing this patient would have consequences far beyond the operating table. "Come on, stay with us," Martinez muttered through gritted teeth, sweat dripping onto his surgical mask. For 45 minutes, the medical team fought to stabilize the general's condition. They followed every protocol, applied every technique, used every piece of equipment available in their advanced field hospital. But the monitors continued to show declining vital signs. "He's not responding to the epinephrine," reported the cardiac specialist. "Heart rhythm is becoming more erratic." The room's energy began to shift from determined urgency to desperate panic. These were professionals who had saved hundreds of lives, but they were watching their expertise fail in the most critical moment of their careers. Anna watched from her corner, her eyes moving between the monitors, the surgical field, the general's face, the movements of the medical team. Something felt wrong, but she couldn't immediately identify what. The heart monitor showed weak, irregular beats. The blood pressure continued falling despite multiple transfusions. The general's skin color was becoming increasingly pale. "We're losing him," Dr. Weber announced, his voice carrying the weight of defeat. "I don't think we can bring him back." The senior physicians began looking at each other with the expression medical professionals knew too well. They had done everything possible, and it hadn't been enough. "Time of death," Captain Martinez began to announce, looking at the wall clock. But Anna was staring at something the others had missed. While the medical team focused on the obvious chest wounds, she noticed that blood was seeping from a different location. A small but steady flow coming from beneath the general's left shoulder, hidden by the positioning of his arm and surgical drapes. Her heart began racing as she realized what she was seeing. The life-threatening injury wasn't where everyone was looking. "Wait!" Anna called out, her voice cutting through the room's defeated silence. "Stop, please. That's not the problem. Look here." Every person in Operating Room Alpha turned toward the young Swiss nurse who had never spoken during a surgery before. A surgical technician later told investigators, "In the middle of 25 people giving up, her voice rang out like thunder." It forced everyone to stop and listen. Anna stepped forward from her corner position, her hands shaking but her voice steady. She pointed to an area beneath the general's left clavicle that had been partially obscured by surgical equipment and positioning. "There's a metal fragment lodged here," she said, indicating a spot that looked insignificant compared to the larger wounds everyone had been treating. "It's small, but it's positioned directly against a major artery. Every time you compress his chest, you're forcing more blood loss from this hidden injury." The entire surgical team stared at the location Anna had identified. Dr. Weber moved closer, adjusting the surgical lights to illuminate the area more clearly. "My God," he whispered, his voice filled with amazement and horror. "She's right. There's a tiny piece of shrapnel, barely visible, but it's positioned perfectly to cause arterial bleeding." Captain Martinez stopped chest compressions immediately, examining the wound Anna had discovered. Blood was indeed flowing steadily from the small puncture, hidden beneath layers of tissue and surgical drapes. "How did we miss this?" Dr. Klaus asked, his voice carrying both admiration for Anna's observation and shock at their collective oversight. First twist. The inexperienced nursing intern had identified the critical injury that 25 combat medical experts had overlooked. Anna's explanation was delivered with quiet confidence. "You were all focused on the obvious injuries, the ones that looked most dangerous, but I was watching the whole picture, noticing where the blood loss patterns didn't match the wounds you were treating." The medical team immediately shifted their attention to the fragment Anna had discovered. Using microsurgical instruments, Dr. Weber carefully extracted the tiny piece of metal while Captain Martinez controlled the arterial bleeding. "Pressure's stabilizing," announced the anesthesiologist, monitoring the general's vital signs. "Heart rhythm is becoming more regular." The transformation was immediate and dramatic. Within minutes of removing the hidden shrapnel, General Bauer's blood pressure began to improve. His heart rate became stronger and more consistent. Color started returning to his face. Second twist. The entire NATO medical establishment's pride had been humbled by a young woman they had dismissed as unqualified. "How did you see what we couldn't?" Captain Martinez asked Anna, while continuing to monitor the general's stabilizing condition. Anna's response revealed everything about her character and training. "In Switzerland, I worked in a level 1 trauma center for 2 years. We had cases where patients died because everyone focused on the obvious injuries while missing the hidden ones. I learned to look for bleeding patterns that don't match the visible wounds." The revelation stunned everyone in the operating room. Anna wasn't an inexperienced rookie. She was a highly trained trauma specialist who had been observing their procedures, learning their military protocols, and quietly identifying their blind spots. Dr. Harrison, who had been summoned when the general's condition became critical, stared at Anna with new respect. "Why didn't you tell us about your trauma center experience?" "Would it have mattered?" Anna asked simply. "You had already decided I was too inexperienced to contribute to critical cases. Sometimes it's better to prove your value through actions rather than credentials." The psychological impact on the medical team was profound. These were professionals who prided themselves on their expertise, their experience, their ability to save lives under impossible conditions. Yet they had nearly lost their most important patient because of their assumptions about a quiet young woman. As the general's surgery continued under Anna's guidance, word began spreading throughout the NATO facility. Radio chatter carried the impossible story. A nursing intern identified the injury that saved General Bauer's life. Fighter pilots flying combat air patrols heard the news through their communication systems. A girl who everyone thought was useless just saved the entire European command structure. One F-22 pilot radioed to his wingman. Ground troops at forward operating bases received updates through military networks. 25 doctors couldn't save the general, but one nurse spotted what they all missed. The story was unprecedented in NATO medical history. A civilian volunteer with no official military medical training had demonstrated diagnostic skills that exceeded the combined expertise of an entire surgical team. But perhaps most importantly, Anna's discovery had exposed a critical flaw in military medical training. The focus on obvious, dramatic injuries sometimes caused medics to overlook smaller but equally dangerous wounds. "We're going to have to change our trauma protocols," Dr. Weber admitted during the continued surgery. "This case proves that systematic examination is more important than experienced intuition." General Bauer's vital signs continued to improve as the medical team, now guided by Anna's observations, completed the surgical repairs. The hidden arterial injury had been the key to everything, the missing piece that explained why standard trauma treatment hadn't been effective. "He's going to make it," Captain Martinez announced, his voice filled with relief and gratitude. "Anna, you didn't just save the general's life. You saved all of us from a catastrophic failure." As news of the successful surgery reached NATO headquarters in Brussels, senior military officials struggled to understand how their most experienced medical team had nearly failed while a young civilian had succeeded. "This is going to require a complete review of our medical training programs," admitted Colonel Peters, NATO's chief medical advisor. "If a nursing intern can see what our specialists missed, we need to understand why." But Anna remained focused on the patient rather than the recognition. She continued monitoring General Bauer's recovery, checking his vital signs, ensuring that all the medical equipment was functioning properly. "Ma'am," asked Lieutenant Chen, the nurse who had questioned Anna's medical studies, "how did you stay so calm when everyone else was panicking?" Anna's answer revealed the philosophy that had guided her throughout the crisis. "Panic makes you focus on what seems urgent instead of what's actually important. I stayed quiet so I could see the whole situation, not just my piece of it." A war correspondent later wrote, "I witnessed the entire NATO medical establishment's assumptions about expertise get overturned by one young woman's to see what others had missed. It was the most profound lesson in humility I've ever observed." When General Bauer regained consciousness 48 hours later, his first words changed the atmosphere of the entire NATO medical facility. "Who saved my life?" he asked weakly, his voice barely audible, but carrying the authority that had commanded respect across Europe. Dr. Weber, standing beside the general's bed, spoke with obvious pride and humility. "A young Swiss nurse named Anna Keller, sir. She identified the critical injury that we had missed." General Bauer's eyes searched the room until he found Anna, who was quietly checking his IV lines and monitoring equipment. He reached out with a trembling hand, grasping hers with surprising strength. "Thank you," he whispered, tears forming in his eyes. "You saw what all of us missed. You gave me the chance to see my grandchildren again." The story of Anna's diagnostic breakthrough spread beyond the Polish medical facility with unprecedented speed. Military communication networks carried reports throughout NATO countries. Civilian news organizations picked up the story, and social media exploded with discussions about the young nurse who had saved a general. But the most profound changes were happening within the medical community itself. Captain Martinez, who had initially dismissed Anna as unqualified for complex cases, submitted a formal letter to his commanding officer. "I misjudged a colleague based on her age and civilian background. My prejudice nearly contributed to a catastrophic medical failure. I recommend that Anna Keller be given full surgical privileges and recognition for her exceptional diagnostic skills." The base medical board, which had previously relegated Anna to basic nursing tasks, now sought her input on complex trauma cases. Her ability to observe patterns that others missed had become legendary among the medical staff. "She sees things we don't see," Dr. Klaus admitted during a staff meeting. "Her perspective from the corner of the operating room, her systematic approach to observation, it's taught us that experience without awareness can be dangerous." Young medical personnel throughout the NATO system began requesting assignment to Anna's unit. They wanted to learn from someone who had demonstrated that diagnostic excellence could transcend formal rank and years of experience. The nursing staff, previously marginalized in surgical decisions, found themselves being taken more seriously. Anna's success had created space for other healthcare professionals to contribute their unique perspectives. Everything changed after that day, recalled Staff Sergeant Maria Santos, a surgical technician. Suddenly, our observations mattered. Our questions were welcomed. She opened doors for all of us. Medical schools throughout Europe began using Anna's case as a teaching example. The story appeared in trauma surgery textbooks, nursing journals, and military medical training materials. This case demonstrates that diagnostic excellence requires both technical knowledge and systematic observation, wrote Dr. Patricia Wells in the European Journal of Emergency Medicine. Sometimes the most important perspective comes from the person who isn't actively performing procedures. But Anna herself remained focused on patient care rather than recognition. She declined interview requests from medical journalists, avoided the celebration parties organized by her colleagues, and returned to her regular duties with the same quiet professionalism she had always shown. The symbol that emerged from Anna's diagnostic breakthrough was her position in the corner of the operating room. Medical students and residents began referring to Anna's corner, the importance of maintaining observational awareness during complex procedures. General Bauer, as he recovered his strength, made an unprecedented decision. He recommended Anna for the NATO Distinguished Medical Service Award, an honor rarely given to civilian volunteers. This young woman demonstrated diagnostic skills that saved not only my life, but potentially the stability of our entire alliance, he wrote in his official recommendation. Her ability to see what experienced professionals missed represents the highest standards of medical excellence. The rescued SEALs from previous missions, pilots whose lives had been saved by exceptional medical care, and soldiers throughout the European theater sent messages of gratitude and respect to the young Swiss nurse who had redefined their understanding of medical expertise. She proved that heroes don't always wear uniforms or carry weapons, wrote Commander Johnson, a SEAL team leader. Sometimes they wear scrubs and carry stethoscopes. The medical facility's culture transformed permanently. The automatic assumptions about capability based on rank or experience began to change. Young healthcare workers found their voices, their observations valued rather than dismissed. If you believe that real wisdom often comes from the quiet observer in the corner, type "quiet eyes" in the comments. 6 weeks after the surgery that saved General Bauer's life, Anna quietly completed her volunteer assignment and prepared to return to Switzerland. She had declined offers of permanent military positions, book deals from publishers, and speaking engagements at medical conferences worldwide. The farewell ceremony at the NATO facility was unlike anything in the base's history. Medical personnel from every department, military officers from every branch, and even some of the patients Anna had cared for, gathered to honor someone who had redefined their understanding of diagnostic excellence. Anna Keller taught us something that isn't covered in medical textbooks, announced Dr. Harrison during the ceremony. She taught us that the most important medical skill isn't technical expertise. It's the ability to see what others have missed. But Anna's response remained characteristically humble. I was simply doing what any good nurse should do, observing the whole patient instead of just focusing on my assigned tasks. The real heroes are the surgeons and medics who save lives every day. General Bauer, now fully recovered, personally presented Anna with a simple gift, a small silver pendant engraved with the coordinates of the operating room where she had made her life-saving observation and the words "eyes that see." "You gave me more than my life back," he told her. "You gave my family the chance to have their grandfather, their father, their husband for many more years. There's no way to adequately thank you for that gift." Anna looked at the gathered crowd of medical professionals, soldiers, and patients whose lives had been touched by her quiet competence. "The best way to thank me is to remember that the most important observations often come from unexpected perspectives. Don't dismiss someone's insights just because they don't fit your expectations." After Anna's departure, the operating room where she had made her diagnostic breakthrough was renamed Observation Suite Alpha. A simple plaque read, "Dedicated to the power of careful observation," in memory of Anna Keller's life-saving diagnosis. The story of Anna Keller became required reading at NATO medical training facilities. Her systematic approach to patient observation, her ability to maintain broader awareness during crisis situations, her courage to speak up when she noticed something others had missed, all became standard teaching points. But perhaps the most important legacy was simpler. Throughout medical facilities around the world, the automatic assumptions about who could contribute to life-saving diagnoses began to change. The questions shifted from, "How experienced are you?" to, "What do you see that others might have missed?" A year later, Anna received a package with a Swiss postmark, but no return address. Inside was a photograph of General Bauer with his 3 grandchildren, all of them smiling in a garden setting. The accompanying note was simple: "Still alive because someone was watching carefully. Thank you." The most important discoveries often come from the person standing quietly in the corner, seeing what everyone else has missed. If this story changed how you value the quiet observers around you, share it with someone who needs to know that expertise comes in many forms. Subscribe to SN Quiet Stories, where we honor the people whose careful attention saves lives. Because sometimes, the person who saves everything is the one everyone underestimated.